This is a study exploring the role of PlGF and uterine artery Dopplers in patients with chronic histiocytic intervillositis of the placenta. Chronic histiocytic intervillositis, or CHI, is a rare but severe placental inflammatory disorder characterized by maternal macrophage infiltration of the intervillous space. Clinically, CHI is strongly associated with recurrent pregnancy loss, severe fetal growth restriction, preterm birth, and stillbirth, with reported recurrence rates as high as 70 to 80%. Despite its devastating impact, CHI is typically diagnosed only after delivery, and there are limited tools to predict disease severity or guide antenatal surveillance. Given the placental nature of CHI, we hypothesize that angiogenic biomarkers and uteroplacental Doppler findings may reflect underlying placental dysfunction and correlate with adverse outcomes. The objectives of this study were to firstly, to describe pregnancy outcomes in pregnancies affected by CHI, secondly, to compare the pattern of serial PlGF and uterine artery Doppler waveforms in a retrospective cohort of pregnancies affected by placental CHI. We conducted a retrospective cohort study of pregnancies with histopathologically confirmed CHI managed at Mount Sinai Hospital. Maternal serum PlGF levels were measured during pregnancy and interpreted relative to gestational age-adjusted norms. Uterine artery Doppler studies were reviewed, with abnormal Dopplers defined as PI greater than the 95th percentile. Pregnancy outcomes assessed included fetal growth restriction, preterm birth, pregnancy loss, and live birth. We included 66 pregnancies with pathologically confirmed CHI, with pathological grade 2 or grade 3 included, and those with mild CHI excluded. The study period was 2010 to 2025, with PlGF available since 2017 in our center. We found the overall perinatal outcomes were poor for the entire cohort. Only 20% of patients delivered at term, defined as greater than 37 weeks gestation. 1 in 4 patients experienced a stillbirth. As is shown in the figure, the majority of stillbirths in red dots occurred in extremely growth-restricted fetuses below 30 weeks gestation. Of those that were live-born, we found that 50% had a birth centile less than the 10th. Uterine artery Doppler waveforms were available for 45 patients. Of these, the majority had normal uterine artery Doppler waveforms. Where uterine artery Doppler waveforms were abnormal, this was often reflected in coexisting placental MVM pathology, as shown in the figure. We found uterine artery Doppler waveforms had a poor sensitivity of 0.22 and a moderate specificity of 0.81 for the prediction of stillbirth. This figure shows the patients who had uterine artery Doppler waveforms categorized by alive in green dots and stillbirths in red dots. This figure shows that uterine artery Dopplers were less informative and not clearly associated with stillbirth in a cohort of patients that had placental CHI disease. In this graph, we have shown serial placental growth factor trajectories for live births in the cohort. The green line shows the 50th percentile, the orange the 10th percentile, and the blue the 5th percentile. Most patients had low PlGF. For patients who experienced a stillbirth, all patients had a PlGF way below the 5th percentile, as shown in the figure. Overall, PlGF had a moderate prediction for the outcome of stillbirth, with a sensitivity of 0.95 with a limited specificity of 0.5. This study shows that second trimester PlGF testing may be used to identify placental CHI disease evolution. Serial PlGF testing is a potential tool to monitor the effects of drugs designed to suppress this immunologic disease, which is important as there is currently no standardized or effective treatment for the condition. In conclusion, CHI is associated with poor perinatal outcomes. Very low PlGF appears more informative than uterine artery Dopplers in this cohort. These are hypothesis-generating findings that merit validation in prospective multi-center research. Multi-center international collaboration is important if we are to learn more about managing this rare and devastating placental disease.